Hello, everybody. Hi, I'm Jewel. Welcome to my channel. Okay, today's topic is the National Kidney Foundation concerned about proposed changes to Medicare Part D. On November the 26th, 2018, the Centers for Medicare and Medicaid Services, which is CMS, issued a proposed rule modernizing Part D and Medicare Advantage to lower drug prices and reduce out-of-pocket expenses. The National Kidney Foundation is concerned that proposed changes to Medicare Part D protected classes will make it more difficult for some transplant recipients to access the drugs they need to prevent organ rejection. Patients want lower costs but are not willing to trade their lives or put their kidney transplant at risk. The proposed rule would remove key protections for transplant patients that allow them to access the immunosuppressant drug regimen that best suits their individual needs and would leave the government in a position of deciding what is clinically appropriate when reviewing Part D formularies. Immunosuppressant drugs are prescribed in combinations tailored to meet the unique needs of the individual transplant recipient in order to achieve sufficient immunosuppression while minimizing the toxicity associated with individual agents. Restrictive formularies limit physicians' ability to prescribe the right combinations of medicines to prevent the recipient from organ rejection and other serious side effects. The delicate balance was recognized in the original decision to include these medicines under protected status. Not all patients respond to the same or just two combinations of medicines. Often the first prescribed drug combination needs to be adjusted or replaced altogether, further underscoring the need to have all drugs available under Part D plans. While we understand the need to control healthcare spending, this is not the way to achieve savings. As of October this year, have been over 30,000 organ transplants in the U.S., and many were Medicare beneficiaries for whom Medicare Part B covers immunosuppressant drugs. While this proposal will impact a small number of organ recipients, it puts those who do get their immunosuppressant drugs under Part D health and lives at risk. It is also likely to result in higher spending while under Medicare Part A and B, particularly if more patients' organs fail, fueling the need for more healthcare services and or the need for Medicare-covered transplant. Most immunosuppressant drugs are generic, and in fact, there has been little innovation in new drugs. A kidney transplant is not a cure, but but for most patients, it is the superior treatment. New medications to prevent rejection and reduce side effects are sorely needed, and the CMS proposal will hinder innovation in this space. While we appreciate the Trump administration's focus on reducing the cost of prescription drugs, we have sufficient concerns with the proposed policy. We are hopeful that CMS will hear out our concerns and ensure that patient safety is the first and foremost priority. Well, guys, when I saw this article, of course, I was a little concerned because I am a transplant recipient. And I have to tell you that I cannot tell you how many times my drugs have been changed. Just recently, when I had my doctor's appointment a month ago, there were some things that had to be changed. Some of my immunosuppressant drugs had to be upped. You know, I was taking 3, but now I take 4. So as you see, when you're have a transplant, there are many things that don't stay the same. You know, things change, your body changes, so the drugs change also. So this concern for Medicare Part B is, of course, my concern too. But I am sure and so hopeful that the National Kidney Foundation and all the agencies are working on this for our benefit. So as you see, guys, there's always something going on in our community, and there are so many agencies that have our back. The National Kidney Foundation is going to meet this challenge for all of us that have had transplants. And I am very thankful that we have them on our side. So, guys, as you see, this is something that all of us go through. Dialysis patients, transplant patients, there's always something, as you see. So, guys, if you like this video and you found it useful in any way, please like, share, and subscribe. And know that, as you see, as they are working for us, transplant patients for our drugs, they are also working for you, dialysis patients that are trying to achieve a transplant. So, guys, just take care of yourselves. Always be compliant to your doctor's orders, and know that we have your back. We are thinking about you. We are sending you so much love, and know that this too will pass. So, guys, take care of yourselves, and I'll see you in the next video. Bye.